Okay, my name is Promise Okafor. I'm a student of BRANDMAN University. This is a signature assignment for NURCs for 2, Integrative Therapy. Integrative therapy is a progressive form of psychotherapy that combines different therapeutic tools and approaches to fit the needs of the individual client. Integrative therapy is a more flexible and inclusive approach to treatment than the more traditional singular form of psychotherapy. My patient's name is Monica. She is a native American and African. She is a 30-year-old female with 2 children. She is married to an African man. She was referred by her primary physician for a psychiatric evaluation. With the current event of the pandemic and systemic racial tension in the country, it has been harder for her to cope with the stress and anxiety in her home and every life. She has been having constant arguments with her husband and her mother-in-law. Her husband has been very busy at work, so she receives little to no attention or help when it comes to raising the 2 children, since her 2 kids have been out of school because of the spread of COVID-19. In addition, she constantly feels overwhelmed from schoolwork from home and living with her mother-in-law at home also. She is constantly criticized by her mother-in-law and her exaggerated expectation of her. She isn't receiving the rapport or the support she needs from her husband. Her mother-in-law waits on her for almost everything, not taking into account that she is studying from home while taking care of the children. The patient is overwhelmed, stressed out, and feels unappreciated by her husband for all the accommodation she has provided for his mother. She's having multiple moments of outbursts, anger, argumentative, and irritability. She reports that she is always running and on the move between her children and her schoolwork and marriage. She feels like there is no balance. She has negative core beliefs that her mother-in-law hates her. Because she never spent quality time with her husband, she has core assumption that her husband might be cheating on her and planning to divorce her. Medical history. Patient denies any medical history. Denies asthma, diabetic, or any cardiac disease. Denies history of hypertension, but has strong family history of hypertension. Denies any surgery. Psychiatric history. Patient denies alcohol use, tobacco use, nor any history of drug use. She has strong family history of alcoholism. Denies suicidal ideation and homicidal ideation. Denies auditory and visual hallucination. Mother had a history of hypertension and father has a serious drinking problem. The patient has experienced a major psychological trauma when she lost both of her parents in a tragic motor traffic accident right after her graduation. Within a year, she was married to her present husband and now has 2 children. Education. This patient is a college graduate who studied informatics, but she could not secure a job in her field, so she's currently in school to be a nurse and a psychotherapist. 3 modalities are cognitive behavioral therapy, dialectical behavioral therapy, and psychodynamic therapy. Cognitive behavioral therapy will help her identify the negative core beliefs. Studies have shown some improvement that CBT can effectively be used in a variety of psychological and psychiatric problems, including some medical problems with psycho components. Dialectical behavioral therapy will provide this patient with new skill on how to manage painful emotions and decrease conflict in relationship in 4 key areas, which are mindfulness, distress tolerance, interpersonal effectiveness, and emotional regulation. Psychodynamic therapy is less focused on the relationship between the therapist and the patient and are more focused on the patient's relationship with his or her external world. This includes helping the patient understand how repressed earlier emotions affect current decision-making and behavior in relationships. Key themes. Core beliefs. One's automatic dysfunctional or positive thoughts are about oneself that may not be founded but assumed, which are subconsciously seated within. Mindfulness, being consciously aware that improvement is needed in the individual's ability to accept and be present in the current situation at hand. A type of psychotherapy key areas that uses the practice of mindfulness to promote good mental and physical health. Distress tolerance, the ability to increase emotional awareness when experiencing and surviving through emotional pain without deflecting. Interpersonal effectiveness, different techniques that assist communicative skills to allow one to carry the ability to be able to be more assertive and strengthening relationship while maintaining self-respect. Emotional regulation, different strategies, different strategic way to manage intense emotion that may have been caused by traumatic moments in one's life. PTSD, post-traumatic stress disorder, an anxiety disorder associated with serious traumatic events and characterized by such symptoms as survival guilt, reliving the trauma in dreams, numbness, lack of involvement with reality, or recurrent thoughts and images. Why would CBT work for this patient? CBT will help assist the patient to center her feeling and emotion when experiencing emotional event with her husband and mother-in-law. Recognizing that how the patient feels or thinks about herself will reflect on her behavior she displays at home. Why will DBT work? DBT specifically focuses on providing therapeutic skills with managing emotion in 4 key areas. Mindfulness will allow the patient to accept her current situation with her husband and mother-in-law. Number 2, distress tolerance will help the patient to accept the emotion that comes with the negative encounters. Number 3, emotional regulation will also allow the patient to cope during those moments of hurtful statements from her mother-in-law. Number 4, interpersonal effectiveness will assist her to communicate her thoughts and feelings in a healthy way while maintaining self-respect, assertiveness, and with the purpose to strengthen the relationship. Then why will psychodynamic therapy work for her? A psychodynamic therapy is a therapeutic technique that focuses more on the relationship between the patient and their external world and less on the patient and the therapist. Because the patient never properly grieved from the sudden loss of her parents and jumped directly into marriage, assuming that it will comfort her, in reality, the pain from that traumatic event was covered up and not properly dealt with. The theory and the techniques of psychodynamic therapy will help the patient to focus on recognizing, acknowledging, understanding, expressing, and overcoming negative and contradictory feelings and repressed emotion to improve the patient interpersonal experience and relationship. Expected result. I expect the CBT for this patient to have a more positive outlook on her to increase her self-esteem, changing her thinking about herself and about the assumption that she carries about her mother-in-law, hateful statements and attitude towards her. In DBT, I expect for the patient to remain calm during any intense argument between herself and her husband, being mindful and aware that the dynamic relationship between her husband and the mother-in-law is because he is her son. Her accepting their personalities, however, using distress tolerance and emotional regulation to cope with any negative emotion that may occur. I also expect to hear that the patient is having more dialogue between her and the mother-in-law to avoid having the husband being placed in the middle, to be open and understanding. Okay, so the psychodynamic therapy, I expect for the patient to be able to talk about the loss of her parents without showing signs of distress. However, recognizing and acknowledging the grief from losing her parents that she never dealt with, the traumatic event of losing parents is causing her to force deposit emotions towards others. Cultural benefit. This is a 30-year-old mixed African Native American female with integrated cultural expression as half Native American and half African American. And she's educated and can complete her homework of journaling. She can articulate, express, and communicate her experiences and her ideas on any problem. The modern African culture is very receptive to the Western medicine and will make the session easier and hopefully successful. If she were uneducated, she would not be receptive to the therapeutic sessions. Cognitive psychotherapy may not be culturally appropriate and effective for her Native American cultural side. Native American culture believes in interconnected mind, body, spirit, and environment, and are more comfortable adopting the traditional healers and interventions like spiritual ceremonies, drumming, sweat lodges for purification. Synthesis. This patient is an educated 30-year-old African American Native American female that has been experiencing a combination problem with her husband and her mother-in-law. Earlier in her life, she had a traumatic loss of her parents, which she never dealt with. This bottled up emotion and dysfunctional behavior have led to a diagnosis of, number one, general anxiety disorder and general depressive disorder, which leads to an exacerbation of post-traumatic stress disorder. Cognitive behavioral therapy, dialectical behavioral therapy, and psychodynamic therapies will help to overcome the symptoms of irritability, anger, and argumentative, low self-esteem, and stress to be more calm, understanding, slow to anger, and filled with self-value. Now she can have a healthy dialogue between her husband and her mother-in-law. So now this is my patient that just came in. Hello, Monica. How are you?
Hello, how are you?
Okay, please take a seat.
Thank you.
This session will be audio recorded. Do I have your permission to do so?
Yes.
Thank you so much. Today we will be using one of the psychotherapy known as cognitive behavioral therapy. This will help you to recognize your thoughts about yourself and how you can change negative thoughts to positive thoughts and feeling, leading to positive functional behavior, okay? There will be a homework, and that homework will be for you to write 5 things you are thankful for, 5 things that you feel about yourself, 5 positive things that you feel about yourself, and 5 negative things that you feel about yourself. Okay?
Thank you.
Okay, do you understand that?
Yes.
Do you have any question?
No.
Okay, thank you. I will see you next week, okay?
Bye-bye.
Bye. The second encounter. Hi, Monica.
Hello.
You are back here for your second session.
Yes.
How are you?
I'm good.
Please take a seat.
Thank you.
Did you do your homework?
Yes, ma'am.
Let me see your homework. Oh, yeah. You have a lot of positive things about yourself. Allow me to read them, please.
Yes.
Oh, you said, I am intelligent. I am not going to give up on my marriage and family. I am in control of my life, and I'm a loving family, a loving wife, and a mother, right?
Yes, ma'am.
That's really good, Monica.
Thank you.
How are you interacting with your husband and your mother-in-law?
I just remind myself of my core values of myself, and I tend to not involve with petty arguments.
Okay.
With, something that doesn't really matter.
All right. Are you feeling good today?
Yes, ma'am. But I did have a little altercation yesterday that really made me very angry.
Well, tell me about it. What
I was
happened?
at the mall. I was shopping for my husband's birthday, and a woman randomly came up to me, a stranger, assaulted me, and called me racial slurs and called me out of
Wow.
my name. Yeah,
I'm
it
so
made
sorry.
me very angry.
Wow, I'm so sorry about that. And then that happened to you. How did that moment make you
I
feel?
was so irritated because I couldn't really hurt her, but I did cuss her out and I got combative with her. The police had to come in and escort her out. It was too much.
Well, today we will be using one of the psychotherapy techniques known as dialectical behavioral therapy. This will help you to cope and manage with those emotions in a healthy and effective way, okay? Being mindful of your situation, managing and regulating your emotion, and being able to effectively communicate your emotion to others, okay? So I want you to remember this acronym, ABC. The A stands for antecedent event that triggers your thinking, okay? And then B stands for the belief or thoughts about events and the situation, right? And then the C stands for consequences of your beliefs or thinking. Remember, how you think affects how you feel, and how you feel affects how you behave. Okay? So now your homework for next week is to write your experience on what happened to you at the mall, and the negative situation between you and your husband and a mother-in-law in a form of ABC, okay? And we will compare and contrast them next week when you come, okay?
Okay.
Does that sound good?
Yes, ma'am.
All right. Do you have any questions?
No, thank you.
Okay, good. I'll see you next week, okay? All right. So, hi, Monica.
Good afternoon.
Good afternoon. Welcome back to your third session. How are you?
I'm doing well.
Please take a seat, okay?
Thank you.
All right. I was meaning to ask you about your parents and your
My
upbringing.
parents, why?
You never really told me much about
Oh,
them.
well, my parents passed away when I graduated. I don't really talk about them that much since they passed.
Okay.
In a
How-
car accident.
Okay, how does that make you feel about their passing?
It's whatever. I don't really think about it as much. I just, don't really think about it. I just go about my day and do what I have to do.
Okay. Well, if they passed away in such a traumatic way, you need to grieve and heal properly, okay? You need to grieve from that. So those same emotions that you try to repress will only reoccur in other triggering situations, okay? And this is called PTSD.
What is PTSD?
PTSD stands for post-traumatic stress disorder, okay? So, but we're going to hold that for next session, okay? Did you do your homework?
Yes, ma'am.
Okay, let me see. Okay. Let me see. Wow, it shows that how you carried the same emotion between you and the stranger and the mall and your husband and your mother-in-law. They kind of related. Irritability, anger, and argumentative, right?
Yeah,
Okay,
I
this,
should show
but at least this shows that you're recognizing these emotions. So that's good. So now it is time for you to manage them, okay? Okay, how was your day today? Tell me.
Well, it's better than usual. This morning, though, something did happen this morning. I went jogging out this
Oh,
morning.
you went jogging?
Yeah,
So that's
it
good.
made me feel good. But
Alright.
this random lady, a stranger again, pulled up on me with their car and started yelling out racial slurs.
Wow.
At first, I didn't hear what she was saying, so I asked her. But, I just later on just ignored her and just kept running.
Okay, that's good. Well, I am very pleased of how you handled it. Huh? How you handled that. So managing those same emotions in a different way resulted into a different behavior. See? Okay, you walked away and went about your day. That was different from how you reacted in the mall with that lady, right? Great job. That's very good. Do you think you could have done the same thing with the woman at the mall or with your husband and his mother if you knew what you knew now?
Oh, yeah, of course.
That's
I
good.
want to make my marriage work and my family work. So
Okay,
yeah.
that's good. Thank you so much. So you can see that it's because you did the work from the traumatic event that happened in the mall. You were able to organize those thoughts, and now you know what to do when you experience a trigger, right?
Yes, ma'am.
Okay, thank you so much. It was nice talking with you. So have a good day.
You too.
Okay, bye-bye.